But we know that sleep can be a big deal in POTS. Actually, we know that some of the hallmark symptoms can be chest pain, racing heart rate, sweatiness while laying down. So when you're laying down with orthostatic disorders and POTS, you're not really moving the body around. Full circulation is not happening. People get this sympathetic adrenaline tone. So sleep can be a big deal. So working with your provider and follow-up appointments about if you're having a lot of sweatiness, restless sleep, awakening due to chest pain, racing heart rate, sweatiness, that's sympathetic adrenaline symptoms. So that's an important aspect and some of the hallmark symptoms. So you can have some symptoms at nighttime. Two is it's very frustrating to talk about. Hear this is that people do have chronic fatigue disorder. It's the number one complaint, and that um, working on sleep is a big deal. People get very derailed with sleep when they're ill because they're exhausted and they start getting up later and napping. One of the most challenging things is to maintain a normal sleep schedule. So that means bed at a certain time, up the same time, no matter what happens at night. You want to maintain that schedule. So that means bed at 10 p.m., up at 7 a.m. And if you are restless, you're up middle of the night, that means it's still up at 7 a.m. and really try not to nap. Also, that means try to keep the technology out of the bed. Just the light of the cell phone and the computer, laptop wakes your brain up. Um, Also, be mindful of how much you're urinating at nighttime. Avoid the excess of hydration at 1 or 2 hours. Review with your provider and follow. Can your medicines make you have insomnia? And if your supplements you're taking, some of them can be very activating in that regards. And also aspects of health psychology, the impact of chronic health disease can also make you have worry, and that can impact sleep. So just some aspects of many issues that can lead to poor sleep. Some of our patients will find who have snoring or are difficulty breathing. We do find sleep apnea, so conventional aspects of sleep disorders we can find. So a quick review of sleep and orthostatic disorders are very important. Many of our patients also have a challenge keeping the head of bed elevated. That aspect does sometimes help reduce urine output. So next morning you don't urinate as much, and it reduces reduction of blood volume. So you should feel less dizzy or lightheaded because you have less urine output. Very few patients can really achieve keeping the head of bed elevated. It's one of the orthostatic guidelines. And I don't usually recommend it for our patients early on because our patients feel so fatigued, so ill, that we're just really trying to get them to do the basic self-care and get a good night rest. Some basic sleep hygiene tips and guidance in the struggles you go through.